Adam, welcome back. You are our first returning guest.
Thank you very much. It's an honor. I must have done something right the first time to get invited back a second time. So let's hope I don't upset it for a third time, maybe in the future.
Yeah, everyone loved that first episode, and I'm sure they're going to get a lot out of this episode as well. So you recently had a low back injury that you've been documenting on social media every step of the way, and we wanted to delve deeper into that experience. So can you start by telling us what happened?
Yeah, sure thing. So it was probably 4 weeks ago now, or coming up to 4 weeks. So I was doing my usual routine weekly session of deadlifts and hamstrings, which I normally schedule in on a Friday. I was working through a 16-week program that I was working to try and gradually build my strength back up to pre-lockdown levels, because in the UK we've been in lockdown for 4 months. So I was working through a 16-week program to try and get back up to baseline again. And this was actually my last session of the 16-week program that I was doing before I was planning on having a rest deload week. And so I was doing some deadlifts anyway. I was on my sort of last set of 3 repetition max deadlifts. And I'd previously sort of built myself up by doing 10 reps, 8 reps, 5 reps sets before. And as I was doing these heavy 3-rep RMs lifts, my first rep I felt something not quite right. And I thought, hold on a minute, that doesn't feel quite right on the first rep. I thought, bugger it, I've only got 2 more reps to go. And then that's done. So I thought I'll give the second pull a go. And immediately on the second rep, I knew something definitely wasn't right. So I got a sudden searing pain into my left-hand side of my back that made me drop the weight instantly and drop me to the floor like a sack of spuds as well, screaming out in agony a bit, getting the old cold sweats and all that sort of business. And yeah, really did give me a searing pain, and took me about a good 5 minutes, I think, of crawling around on the floor till I finally pulled myself together and swearing a bit, managed to try to stand up, but realized I couldn't fully extend. I couldn't get into a straight position. So I had to sort of stoop over, managed to rack the weights, and spent the next few minutes trying to sort of contain myself, compose myself, work out what I'd done, collect my video, because I'd filmed it, because I was filming my lifts as I was doing it as well. So I collected my video, had to scroll back, look to see if I could see what happened. And yeah, it was one of those things that took me a while to feel like I was able to leave the gym, but I cancelled the session straight away, walked out, managed to get into the car, drive myself home. And the next few hours, I thought, this isn't too bad. I thought, actually, I just escaped something major, because my pain in the back started to feel okay. Still couldn't stand up straight. But then the next day and the following days after like that, man, the pain just kicked in with a vengeance. So I suddenly started to get this intense pain, not only in my back, but now radiating down into my left groin and down the front of my thigh as well. And it was constant searing neuropathic pain as well. So this started to lead me to think, I've done something to the nerve root here. And probably about 10, maybe 12 days after I did it, I also noticed that I was having some sensory deficits. I'd lost sensation in my left knee and medial shin. And I also noticed that I'd lost about 50% of my left quadricep, my knee extensor power as well. And that sort of gave me the conclusion then, after a couple of days, of say nerve root compression, so an L4 nerve root radiculopathy, and that's most likely due to a disc herniation, although I haven't had any imaging to confirm that, but that's just my clinical assessment and diagnosis. So that's, in a nutshell, what happened.
Have you had an experience of low back pain or radiculopathy like this before?
Never had radiculopathy. I've had intermittent back pain, but nothing I would class as this severe or intense. I've had the old muscle pulls and tweaks, as most people do throughout life. I had a few training related back injuries or pains, I suppose. I wouldn't even class them as injuries, that give you those couple of days of soreness, but nothing like this. This is really my first big episode of back pain with radiculopathy. Yeah.
And how about you? You mentioned that you were doing your 3-rep max deadlifts. On that first repetition, you felt something, maybe it didn't feel quite right, and then you went on to do the second rep. Is that something that you've done in the past also, and it turned out fine, or was this different?
This is different. This is where I blame pain science now.
Yeah.
I blame them. Well, I don't, but in tongue in cheek, I do. But no, I think if you had asked me 10, maybe 15 years ago, a little bit less experienced of knowing about, what I know now, I would have probably been a little bit more cautious. I would have probably been a little bit more fearful and a bit more fear avoidant of doing that second rep. But because, we've learned, pain doesn't always equal harm and, all that sort of stuff. I perhaps, in hindsight, did that second rep a bit stupidly or a little bit too naively. And perhaps I should have respected and listened to my body a little bit more. But because of what I've been taught and what I've been teaching other people, perhaps I didn't do what I should have done or would have done 10 or 15 years ago. As I say, hindsight's perfect. You can say all these things now after the event. But yeah, I do think that that first rep really should have been my clue to say that second rep shouldn't have really been done.
Yeah. And then how about, as physios, we often ask patients, like, has anything changed in your life significantly, right, in the past 3-4 months that you think might have contributed to symptoms? So obviously you could have ended that first rep, but you mentioned that maybe you weren't at your pre levels of strength. Do you think being out of the gym had to do with leading up to this, or not so much?
Yeah, absolutely. I do think, this last, 12, 18 months of having interrupted access to my usual gym sessions, because I've trained more or less, regularly between 3 to 5 times a week in a gym using resistance weights for 25, 30 plus years. So having these, 3, 4, 5, sometimes longer months of not having access to the gym and using home training, which, you can substitute, you can use dumbbells, but it's never the same. The maximum weight I had in my home training was 80 kilograms. So I was only able to deadlift with a maximum weight of 80 kilos. And that's even me trying to strap other things to the dumbbells with some bands and some ropes and some belts to add a few extra kilos on, but it was never comfortable to do that. So yeah, I do think that has a role to play in it. And when I look back and I try to, work out, what were the predominant factors that led up to this injury, I don't think there is one particular thing that I would stick a pin and say it's definitely this. Is clearly a combination of things, and that's the things that we know, is normally the case with most injuries. It's a combination of factors that are meeting together to create the perfect storm, so to speak, that creates this situation for an injury to occur. And it may be that, one of these factors, if it just wasn't there on that particular day, would have mean you've got away and not had that injury. But because it was there, combined with all these other factors, that's the one that may have given you the injury. So I think, that interruption with lockdowns is one of them. The other one, I think, is, again, getting close to the end of a 16-week period of tough training as well. I was fatigued. I was feeling quite knackered on that session. So I'd done 2 other previous sessions at that weight the 2 weeks before. And this was my 3rd week at the same weight where I got injured. And those other 2 sessions were fine, but I felt fresher. And this session, I did significantly have a higher fatigue rating in hindsight. And the other factor as well that I also think was probably a big factor that probably led up to this injury was the reduction in rest periods that I had between doing my sets. And the main reason for that is that somebody was waiting to use the platform behind me. And when someone comes up to you in the gym and says, "How many sets you got left there, mate?" It always puts that little bit of subconscious pressure to rush through your rest periods. So when I'm doing, anything between 5 and 3 RMs, I'm normally taking 3 to 5 minute rests between sets. And I think in hindsight, because this guy had come up to me after my second set and I had another 5 to do, he said, "How many more sets you got?" I felt pressured subconsciously to not have as long rest periods. So I probably reckon I was only taking 60 seconds, 90 seconds, opposed to my normal 3 to 5 minutes in between sets. So I think that was also another factor that sort of probably contributed to it. But again, the other thing I also say as well is that sometimes shit just happens, and again, that's the other factor there. There's the unknown factor why I got injured. So it could have been just that.
Yeah, I know the feeling of feeling rushed. I used to work out at Gold's Gym, and when somebody asks you that question, like, it just gets to you. And I didn't have a back injury, but I've had those experiences where, like, the workout just doesn't go the way you want it to because you're in a little bit of a rush.
Yeah, there's 2 ways of dealing with that, because I get that quite a lot in gyms that you go to when people says, "How many sets you got left there?" And you can turn around, look them steely cold in the eye and go, "Got 23 sets left to do." And just leave that little awkward silence and see what happens. Now, normally they'll go, "Okay, all right," and they'll go and find something else to do. But every now and again, you'll get someone who will just go and they'll double down on you and go, "Cool, And then they'll just sit there looking at you whilst you're doing your sets and put that little bit of pressure on you, and you're like, "Argh." So yeah, I do think that sometimes, as I say, is something for us to consider, is that when we have that somebody else observing and watching what we're doing, it adds extra stress as well. I was also a bit stressed because I was rushed for time as well, because I had patient appointments in the afternoon, so I was running a bit late as well. So I'm not going to solely blame it on this guy for rushing me through it, but he was a factor in it. In fact, fuck it, let's blame him completely. He's the one that caused my injury. Going to hunt him down.
So what's the recovery process been like? You said it's been like 4 weeks. You've had, this back pain, changes in quad strength, some sensory deficits. So yeah, what's that process been like?
It's been fucking painful. It's been stressful. It's been frustrating. It's been really tough at times, especially those first 2 or 3 weeks. That constant searing, unrelenting neuropathic pain that's stopping me from sleeping, that's waking me up, well, not even allowing me to get to sleep actually some nights. It's been really horrendous for a good few weeks, but it's also been an interesting and enlightening journey as well. So going through this process, I think on the other side of the fence now as a patient rather than just a physiotherapist, has been a real good experience for me. And as I said, I've had injuries before, I've had various different pains before, but having this constant, persistent, unrelenting pain has just actually put things hugely into perspective for me, because I know we see people in pain a lot as physiotherapists, but there is nothing like having some first-hand experience of pain and injury to actually hammer home to you and make you realize what it feels like and what the emotions and all the thought processes and the fears and the doubts that start to rush through your head and start to worry you at 3 o'clock in the morning when you've got this constant situation of pain and discomfort in. So this episode has really hammered home and emphasized to me that having fears, doubts, and concerns when you're in pain is perfectly normal and perfectly natural. And it's something that I think, we as physios and healthcare clinicians have just got to recognize. And we've got to stop labeling people that have fears and concerns and thinking the worst. We've got to stop labeling them as yellow flags or having adverse or abnormal behaviors, because they're not fucking abnormal behaviors. I class myself as a educated, experienced clinician who knows, what pain is and injury is. Yet I was still thinking the worst. I was still doubtful about my prognosis, even though I know low back pain and even radiculopathy has a favorable prognosis. And I could self-assess myself and say I had no worrying, serious or sinister features that were causing me any concern. I still had doubts. I still worried about the fact that, do I need to do something? Am I going to go and have to see somebody? Am I ever going to get better? Am I going to be like this for the duration? And I say that's me with 20 plus years of experience. So I think we just got to recognize that for people that don't have our experiences, that don't have our knowledges, to get those thoughts, feelings, and emotions is perfectly normal. And we need to empathize and recognize that more with people. So rather than labeling them as having yellow flags, adverse behaviors, just acknowledge that these things are normal for people to experience. And I think there's a lot of good in that, by just recognizing it and understanding it and explaining to somebody who has got this concerns and is freaking out. It's perfectly natural. Yeah, it's okay. No problems with that. You freak out. It's okay. Don't try and change it. Just ride with it and say it's perfectly normal to feel like this, because I did.
So do you think that you had an advantage as being a physio from the knowledge that you had for that, though? So me personally, I've been in similar positions where I've had the exact same fears, freaking out about things, especially when it comes to back pain. I don't know. I'm sure there's lots of reasons why we could go down that path, but having bouts of it, having high concern, but I'm able to talk myself off a ledge better than I think obviously most patients are. And so do you feel like that was beneficial for you?
I think it's a bit of a double-edged sword, knowledge. I think, you're right. Sometimes you have that knowledge that does talk you down and go, look, okay, rational brain kicking in. Okay, what the statistics are. Okay, I know what the research says. Okay, I can calm myself down. But then there's that other side that has that little bit, but what about if you're one of the other side? What if you know the worst case scenario as well, because you've read about those case studies and those ones that don't do what you expect them to do as well. So I think sometimes, there's that curse of knowledge that can be not detrimental, but it can sometimes just plant a little seed in your brain and just make you ruminate and just worry about things that have got a very low statistical likelihood of occurring. So again, that's something I think we have to recognize, that when we do get injured, we will probably sometimes automatically think the worst because we are aware of those. And I think, again, that's something that I see on social media. We tend to talk about all the worst case scenarios more because, you know, they're the things that have serious consequences. So I think we get taught to focus and look out for all these serious adverse side effects and consequences a lot more. And so that, I think, just heightens our vigilance towards these things, when statistically they're very unlikely to happen. So I think we spend a lot of time talking, discussing, training and learning about the 1% things that can go wrong. And the 99% of the things that normally happens is the bit we don't spend as much time focusing on and dealing with and knowing how to manage it well.
Yeah, I've been in that position from the perspective of my hip replacement, where I've done something, pushed too hard in the gym. You know, I have this severe pain for a couple of days. And then in my head, I'm thinking, did I just, you know, ruin my hip replacement? Am I going to have this redone? And I think to myself, well, if I think this, right, I can really understand where patients are coming from. And we understand how secure and stable and great the surgery is. But if they have a little bit of pain, it's very, very normal for them to say, wow, did I ruin this? So I think that's a great point that you bring up there. In terms of your recovery, have there been things that you've been doing along the way that have helped you, especially since, you know, you're having difficulties sleeping, finding positions of comfort? You know, I know you like to exercise. So what have you been doing?
Yeah, so it's been quite interesting going through this process to see what has helped my pain the most. So, you know, analgesia is what most people will go for when they've had pain. So they'll look for tablets or medications. And I've actually found those pretty ineffective personally, especially for my sort of neuropathic pain. And I went to see my GP, my physician, and got prescribed some neuropathic painkillers. And I found them not really that effective. What I have found so much more effective is movement, activity, and funnily enough, hot baths. I've fallen back in love with hot baths again. And I put a rather cheeky video out on social media of me soaking in a hot bath, because that was the first time I actually got some significant pain relief after 6 days of serious neuropathic pain. And that's even taking regular medication. So again, something as simple and as, you know, as cheap and easily accessible as a hot bath far outweighed all the other things that I've been trying to do to control and manage my pain. So I am now a big believer of trying. I mean, I always was promoting these ways and means of reducing pain to people and to patients that I saw, but I have definitely now got more love and more conviction that these things are actually the better things to do for a lot of pain and discomfort, other than pharmacological management. Because yeah, I'm not going to say it didn't help at all, but the best things I found are the much easier, simpler, readily accessible ways to manage pain. Walking, movement, which at 3 o'clock in the morning was a bit of a bitch, but there we go. I had to do it, you know, because I wasn't comfortable wriggling around on the living room floor. So I got up and went out for a 20-minute walk at 3 o'clock in the morning and got that temporary pain alleviation after I did it. But that, and say hot baths, definitely what I found really useful over those first few weeks.
Bubbles or no bubbles?
Definitely bubbles, absolutely.
Nice. And I saw that you recently got back in the gym. You're doing some leg extensions because you're trying to regain some of that strength. But you're also deadlifting again, I think. So what made you decide to, you know, jump back into that?
Yeah, a combination of things. One is just understanding, you know, normal natural healing tissue times as well. So the basic physiology of inflammatory processes and cycles as well. And knowing that obviously tissues respond well to stresses that actually help stimulate heal processes. So, you know, it's like when you break a bone, you know, you have a period of time to let things settle down, but then the actual bone remodels and becomes stronger when you start to weight bear and stress through the bone. And I don't think that's any different with any other type of tissue and injury. You know, you just have to respect the natural healing processes and then start to gradually expose it to stresses and strains to encourage it to heal nice and strong. So with disc injuries, I don't think we need to be that much different. And I've had quite a few interesting conversations around that with lots of people and lots of fear about how I'm going to cause re-herniations by bending over and putting my shoes and my socks on, and I have to avoid all flexion for fucking 6 weeks, which is just crazy talk in my opinion. And the other factor is to say, it's not only just basic physiology, but also listening to what my body's been telling me. And it's felt fine to flex. In fact, it's been the best position and the most comfortable position throughout this whole journey, is going into flexion and deadlifting flexion. So I thought I'd give it a go. So I think it was about 21 days, about 3 weeks afterwards, I just used a very lightweight and tested it out. And again, just gently eased into it, graded my exposure to it, tested it out. And I think, that's a lot of what physiotherapy is. A lot of the time we call it test and retest, but it's a bit of trial and error, if you want to use more simpler layman's terms. See how it feels. Is that everything okay? Yeah, good. Right. And progress from there. If anything doesn't feel right, listen to it in the acute stages, respect it, maybe back it down a little bit, maybe give it another week and try it again later on down the line. So that's pretty much what has led me to doing what I'm doing back in the gym now at 4 weeks down the line.
Nice. And I know, the fact that you're documenting the process has been helpful for a lot of physios, a lot of patients who are, kind of in your shoes. But I've also seen and followed some of those conversations. I know you have a big following on Instagram and on Twitter. So for yourself, do you feel like documenting this process has been, beneficial, harmful, a little bit of both? What do you think?
Yeah, pretty much a little bit of both, Mark. I found it, there's been some huge positives and also some negatives as well from doing this. I've had so many messages from people, telling me about how useful and interesting they have found me documenting this process as a physiotherapist and now obviously as a patient. And I think the most common message I get from people who have found it useful is just me being open and honest about expressing my thoughts, doubts, concerns, and fears as a physio with experience. And that's actually, I think, just normalized what other people feel and go through as well. So many people have sent me messages saying, thank you for saying that. Thank you for sharing that, because I thought exactly the same thing. And I've been worried about exactly what you've been worrying about. And it's so good to hear that, you're thinking that and you're worrying about that as well. Makes it feel normal for me. And I'm like, yeah, it's perfectly normal. So I found that has been really positive. And again, the real encouragement that I've had from people sending me kind, motivational, encouraging messages, as well as telling me I've got this and go on, you can do all this as well. That has been so helpful for me. And again, has just hammered home to me and, really re-emphasized to me how useful, simple, beneficial support, encouragement, and a kind word can be when you're in pain, when you're stressed, when you're fucked off. And again, I'm just going to stress this to any healthcare clinician. Do not underestimate the power of just telling somebody it's going to be okay. Just reassuring them, giving them a kind word, just being there as a soundboard for them to talk to. That is so beneficial. And these messages that I've been getting for people, it's just been really encouraging. 3 o'clock in the morning, agony, thoughts going through my head. I've been scrolling through these messages and going, that's so nice to hear. Thank you very much. That's great. Yeah. And it's just so bloody useful. So clinicians just recognize that is probably 90% of what you do when people have acute pain, is reassure them, calm them down, be kind, be empathetic. That is really, really, really useful and really helpful, and is also a bloody good painkiller as well. So those are all the positive aspects of me documenting my process. But then there's the not so positive side of it as well, which has been all the sort of sneaky, snide, downright nasty bloody messages I'm getting as well. And what's really surprised me, I mean, I'm not naive enough to think you're not going to get some trolling. You put anything on social media, you get some bottom feeding scum that will come up and say something hateful, because that's just people nowadays. But I was not expecting to get the amount of, say, nasty, sneaky, snide messages from so-called kind and compassionate and caring clinicians. So, over this process, I've been accused of being in denial, stubborn, ignorant, arrogant, many other things ending in T as well that I won't mention on here, just because I have been documenting and sharing my journey publicly and highlighting how things can be managed quite successfully, quite well, with a simple, pragmatic approach. And that seems to have wound a lot of clinicians up. Now, the reasons for that, I think, are multifactorial. I think there's just a bit of jealousy and hatred for me because they don't like the position that I am in. They wish they had it, and they don't like the fact of that. But I also think, there's a lot of insecurity in the physiotherapy and other therapy professions as well. A lot of people just don't like the fact to think that they're not as needed as much as they think they are. And so they get very resentful and hateful when somebody starts to show that that is the case. And then, you know, I've had some complete and utter arse biscuits telling me that I deserve my pain or that I've earned my injury because of my reckless attitude to training and my terrible lifting technique. And I've had some pretty heated and fucking outrageous conversations with these idiots who, again, still in this day and age, think that something like a back pain and injury that I've got is purely just down to the lifting technique that I was doing. So again, you know, there's lots of reasons why I got injured, and it isn't just down to technique. Now, I'm not going to say there wasn't a part to play in that, because I will do, and I will admit that looking back at the lifting technique, you can see I'm clearly fatigued. I haven't got the tension that I should have when I'm doing a lighter load. But again, you just got to recognize that when you're doing heavy reps and you're doing heavier loads, you're not going to be using the same movement strategies as you will do when you're using lighter loads. So when these people then start saying, this is how you should deadlift, and they demonstrate it, I'm like, yeah, but you're using less than fucking body weight there. I was doing 2.5 times my body weight when I injured myself. I said, I want you to demonstrate your nice, perfect, pretty, pristine technique doing 2.5 times your body weight on a deadlift, please. If you can keep that technique, then I will say, okay, and I might have a conversation with you and listen to you. But until you do that, we ain't going any further. And that tends to shut them up. So they can demonstrate all these nice techniques, but only with lighter weights. They can't do it once you start pushing the weights. And yes, there could be a role here that you could say the heavier the loads, the smaller the greater the injury risk could be, perhaps, maybe. But again, there's so many other variables around that as well. Training age, training history, fatigue state, all these other factors as well will determine, you know, whether somebody may or may not get injured as they do a heavy, intense lift as well. So again, this just highlights to me still that we've got such a long way to go in the healthcare and fitness industry to get some of these, you know, messages across to people that injuries are just not simple as poor lifting technique or poor exercise technique. So yeah, it's been an interesting journey, and it just highlights how many, again, throbbing bellends there are out there, just little nasty, pathetic, odious cretins as well. But again, that's human nature, I guess.
Yeah, and with regards to the technique, like you mentioned already, you're at the end of a 16-week block. You're kind of chronically fatigued, maybe acutely fatigued from rushing the set. You had, you know, patients that you had to get to, so maybe your mind wasn't into the workout. And that's just like the tip of the icebergs. Like you said, just attributing it to one thing that you've been doing for probably 30 years just seems, you know, really reductionist.
Yep, it is. And again, but try telling that to all the armchair experts out there and the internet movement specialists. You know, it's very hard to get those messages across to them because they will just not have it.
And I think one of the best things about you documenting this is that patients often feel like they're on an island, and, you know, that they don't have somebody who can relate to their experience. And you're showing them that, you know, you can, and there are other people like them. And I'm sure there's people who like are talking to each other in the comments, and they're relating their experiences. And I find that valuable, especially from somebody with your audience, is because people think that people with these large audience who promote, you know, exercise and who are physical therapists are bulletproof and pain-free for life, right? Like that's what we see out there, is that bulletproof and pain-free for life. And it's just not realistic. And I think that, you know, at the expense of your back and all of this, I think it's a good thing that you're able to, you know, demonstrate what's real, right? And being bulletproof and pain-free for life isn't real.
Yeah, no, I've had a few of these comments as well. I've been called a shit physio for being injured. And I'm like, well, do you think doctors are shit doctors for getting ill then? And they're like, no. Well, why can't a physio get injured? It just doesn't make sense. Do you think a surgeon should never have surgery if they need surgery then? You know, it's just, do you think professional athletes are shit professional athletes if they get injured as well then? You know, it just doesn't make sense. We're all human beings at the end of the day. Just because of our job roles and our profession doesn't mean that we're any different than any other type of other human being. So yeah, crazy talk by some of these people. And
I know, like, obviously you saw your GP, you got some medication, but you didn't seek out, you know, the advice of another physio. And I know you compared that to a mechanic seeing, another mechanic for a car problem. So can you expand on that?
Yeah. So again, I've had lots of people getting rather annoyed and irate at me because I haven't rushed to see another physiotherapist to get assessed and to have some treatment. And so I've been having lots of people, they've often thrown this little saying at me: a physician who heals themselves has a fool for a patient. I'm like, fuck off with that, because that's absolute crap. Because I know physicians treat themselves all the time when they have the signs and the symptoms of a common, simple illness like a cold or a snuffle or a simple fever. All right. Doctors do not go and seek the consultation of another doctor when they've got a common cold. And so, physicians are able to assess and diagnose and recognize the signs and symptoms of simple illnesses and conditions that do not need further interventions or aggressive treatments. So it's no different for a physiotherapist like myself, who can assess, diagnose, and recognize the signs and symptoms with my condition that lead me on to think that I do not need any further test investigations or treatments. And this has a favorable natural history with time and management of my pain and keeping as active as much as I could do, which is what I'd expect anybody and advise anybody else who came to see me to do. So I'm treating myself as I would treat somebody who comes to see me. And that doesn't mean that just because I can do it this way, that I am saying or stipulating that everybody should be able to do it this way as well. Because that's another straw man that I've had thrown at me left, right, and center day after day here. Are you saying that everybody should be able to self-manage their back pain and never see a healthcare professional? I'm like, no, I'm not fucking saying that. I'm just saying I can, because of my 20 plus years of clinical experience and training and being well read around fucking back pain and radiculopathy. So I can manage myself because of my background. Now, Joe Bloggs down the road, who is a mechanic or who is a bricklayer or something, hasn't got the knowledge, the training experience that I have, and will not be able to recognize these signs and symptoms, and so is probably concerned. So absolutely does need to go and consult a specialist in that area. Just like I would if my car started to make some rattles and go junk and the warning lights come on. I've got absolutely no idea about car mechanics. I'm going to go and consult a car mechanic and say, what's going on in my car here? I'm a bit concerned. I don't know what to do with these signs and symptoms it's displaying. Now, again, that's no different, but a mechanic would be able to go in his own car when it's going ka-junk, and the warning light comes on. The mechanic goes, I know what that is. I've got a loose triple overhead manifold sprocket. I just need to tighten that nut up. Job done, sorted. I don't need to go and take it down to the garage to consult another mechanic. So again, it's just recognizing that some individuals have skills, knowledge, and experiences to be able to deal with things differently than other people. That's all I'm trying to say there. But yeah, so I haven't gone to see anybody to get further assessments or treatments or investigations, because there's just nothing in my clinical history or my presentation that warrants it. There's nothing that's going to change my management, which is going well. I'm improving. Things are getting better. So why would I bloody want to start doing other stuff that may affect that? There's just no need. So that's why I have not sought the advice or assistance of anybody else. Not because I'm stubborn, not because I'm arrogant, not because I know it all, just that it's not needed.
Yeah, Sam and I had this discussion yesterday, the other day too, that we haven't, sought out other physical therapists, and it's unlikely that we would. And I think we both have seen other physical therapists as patients, and that's fine. And it probably maybe goes into our philosophy of how the three of us, quote unquote, treat, in terms of if you're seeing somebody else, you're not seeking them out for hands-on therapy or needling or any other passive modalities. So yeah, you're not seeking like treatment in that traditional sense, whereas maybe other clinicians are.
Yeah, and absolutely. If you want to go and get some pain modulatory treatment to see if it helps reduce your pain, nothing wrong with that. But most of my pain problems are at 3 o'clock in the bloody morning. And I don't know any bloody physiotherapist who's going to be quite happy to come, or for me to go and see them, to give me some pain modulatory hands-on therapy when my pain's really at its worst at 3 o'clock in the bloody morning. So, I had to work out some ways and some strategies to manage my pain when it's at its worst in my particular situation. And it's just so, and physiotherapy, hands-on therapies are just not going to do that for me. So I had to find some other way of doing it, and say that's where the walking comes, that's where the hot baths come, that's where a bit of simple analgesia comes in.
And if your radiculopathy, either the weakness, sensory deficits, both, if they were getting worse, would that be an instance where you might consider seeing, orthopedic consult and, imaging?
Absolutely. So again, a lot of people are saying to me, well, you're going to suffer for this because you're only going to get worse. And I said, no, because that's where I would go and start to get some further investigations and treatments if things were going worse. So yeah, absolutely. I think, there are times and places where we've got to recognize I do need to go and seek further assistance and perhaps have some further tests and investigations for something else, and we're talking, if there's any signs of anything serious or sinister in the pathology that can sometimes happen with acute back pain. So, if I had a bony deformity on the side of my back and I had a spinous process sticking out where it wasn't supposed to be, I'm not going to self-manage that. I'm probably going to go down to A&E pretty sharpish. If I couldn't weight bear, if I had no bloody pulse in my foot, if I had a total loss of muscle power, I've got absolutely no knee extension mechanism whatsoever, or I've got saddle anesthesia, or I'm pooing and pissing myself, or I can't get a stiffy and I've lost my erectile function. Those things are going to be pretty fucking unnerving for me. And even with my knowledge and ability to say and recognize that, I'm going to go and fucking seek some pretty quick, urgent medical assistance and treatment and interventions for that. So again, it's just recognizing when you do need to move things on and when you don't. And then one of them would be if my symptoms were deteriorating. So that's a red flag. So if my symptoms were progressively getting worse, so my pain levels were getting worse, my function was decreasing, my motor deficits were increasing, my sensory deficits were getting worse, absolutely, I am going to seek further investigations and assessments on that. But at the moment, they're not. I think the problem comes in is that I don't think many patients out there, but also a lot of healthcare professionals just don't realize how long these things sometimes take to start to show signs of improvement. And so they lose their nerve and they then start this downward spiral of further tests and investigations way too early, where they probably just need to hold on a little bit longer. And it's a bit of a gray area. And this is where it all comes into about trying to manage uncertainty, as a clinician. It's tricky and it's tough. And it can make you feel a bit on the edge and a bit anxious about, am I doing this right by just sitting it out for another week, or should I start to think about moving things forward? But, when you're dealing with something like an acute episode of low back pain with radiculopathy, you've got to expect at least 6 weeks before the significant amount of pain starts to ease off, and that's hard to tolerate and that's hard to accept. I know I'm week 4 into it now and things are improving, but I wouldn't say I'm still 100%. So I'm through the worst of it, but those first few weeks can be quite scary. And you're sitting there going, no, you'll be all right. You just got to keep going with it. And then you're sitting back and crossing your fingers and going, I bloody hope that's right. And it is a little bit of a risk, but that's what we do as clinicians. We have to manage the risk and we have to manage the uncertainty. But we also have to recognize that time is the factor, and we just got to not underestimate how long things take. My radiculopathy symptoms, I'm expecting, again, from reading the literature, then probably not to show much sign of major improvement, definitely probably for 3 months, maybe up to 12 months. So I may still have left quadricep weakness for up to a year after this, to a certain extent. Now, I'm hoping it doesn't last that long, and I'm hoping that I get some signs of recovery quicker than that. But I've just, at the back of my head, just planted that seed and said, that's your time frame to probably expect things to take, worst case scenario. Now, I'm hoping, as I say, it's going to be a couple of months, but we shall see. Time will tell.
And thinking about that, do you have a time frame on how long you plan on continuing documenting this process? Like, you've been doing it pretty much daily, but is there going to be a point where you're saying, okay, I got to just put out a video once a week, once every few months until full recovery?
Yeah, because it gets a bit boring, I think, once you get through those first stages, just a report going, yeah, everything's the same. It's the same as yesterday. It's the same as yesterday. So I'm pretty much in that stage now. So I've gone through, the major worst searing neuropathic side, pain, inflammatory side of it now. It's pretty much stable. There hasn't been much change, I think, in the last 2, 3, 4 days. So it's a case now, we'll be just probably doing weekly check-ins up until hopefully I get everything back to square one again, which 3 months, 4 months, 6 months, who knows? But I think the main thing that's going to take the longest is my quadricep strength, my knee extensor strength. I'm not really fussed about my sensory deficit. So what if I've got a numb left shin? No major problem. Could be an advantage in a life-threatening situation. Somebody wants to stab me in my shin, I go, can't feel it. It's my self-defense superhero mechanism now. So I'm not too worried about my sensory deficit, but yeah, it's going to be my quad deficit. That's the thing that I'm probably going to keep the closest eye on and document and monitor. So I've got myself the dynamometers out. I've measured some baseline tests, and I'm going to do probably weekly checks on that and see how that goes.
Nice. Yeah, I'll be looking forward to that. And I've liked that you've, the past few days, you've been posting about different research related to low back pain and disc herniations. And same thing, it seems like you've had a really positive response to that for people who have been following your journey and then seeing this research. So I think that's like, a nice compliment to everything that you're doing.
Yeah, and it's good that say you get an injury, because it's nothing, again, like I said, of having something exposed to you to force you to go and start reading a bit more around it.
Yeah, and so as a practicing physio, what have you learned the most from this experience so far? And it's only 4 weeks in, and obviously you're going to continue to learn, throughout it.
Yeah, I think, again, I've probably already mentioned this, but I think, the main thing is that, it's about recognizing how doubts, fears, concerns are perfectly normal when you have an acute injury. Frustration is classic. I've been really annoyed and, beating myself up, angry with myself, lots of self-blame. Did I do this wrong? Why did this happen to me? Woe is me. It's all perfectly normal, natural. So I think that's the biggest thing I probably learn, is these emotions and thoughts and feelings are all perfectly normal and natural. And again, probably, the real positive benefit of support, encouragement, simple advice, making people feel calm, not stressing them out about, what, could the worst potential factor could be happening, giving them some, simple, clear, rational advice, but lots of kindness, empathy, and reassurance is really, really beneficial when people have pain and injuries. So I think those are the main things that I've probably picked up through this process and just re-emphasized to me.
And on the flip side of that, as a patient, is it kind of just the other side of that coin in terms of knowing that having these fears, anxieties, worries are normal?
Yeah, absolutely. And I think, it's just accepting that, no matter how resilient and tough you think you are, pain adversely affects you. And it's okay to admit that, and it's okay to accept that, which can be hard if you are a stubborn git like me. But it is something that just affects all of us. When you have pain like this, it's just something that you do need sometimes to reach out, and you need some help and support and family and friends and networks and clinicians. This is what, are really, really useful. This is where I think the human species has an advantage over other species, because when you're an injured lion and something, or you're an injured giraffe, sometimes you're just left and the rest of the herd carries on and doesn't give you any support and encouragement, because it's a survival instinct. And us humans, we don't have to do that. We can help and support and help people back to function again. Has
your wife been pretty supportive of this process? I know that's something that we deal with, as physios, is significant others, where some significant others are too protective, right? And they tell you, hey, don't go back to the gym, stay on the bed. So how has that been for you?
Yeah, no, she's been great, but she's not a healthcare professional at all. So she has been, a little bit of both. I think, she was very concerned and worried in the initial stages. And then she went through, I think, that compassion fatigue, where it's like, why aren't you better yet? It's 3 weeks now. Come on. I'm like, it's going to probably take a couple of months before it gets better. So there has been an element of both. Yeah, but she has been great, and very concerned and worried and supportive at the beginning, and probably just getting a little bit bored of it now, because it doesn't seem to be changing much or as quick as she anticipated.
Yeah, she's not bringing you glasses of wine and
extra
bubbles anymore.
She's not sitting there stroking my head anymore as I'm sort of wincing in pain.
Is there anything else that you want the listeners to know, either the clinicians listening or, patients who are going through a similar experience as you?
I think to the clinicians, first and foremost, I think, I'm just going to reemphasize, listen more to those that come to see you with their pain. be thorough in your questioning, your examinations, and ensure you do your due diligence to exclude the very rare but sometimes serious side effects that can occur with acute injuries and pain. So that's just doing your due diligence, just being a good clinician. But really, the main thing as a clinician is just be kind, empathetic, and understanding of those people who come in to see you, who are worried, distressed, freaking the hell out because they've got some pain that they don't understand. It's perfectly normal, perfectly natural. So again, your job is to listen, empathize, reassure, and encourage, not do the opposite of scare, worry, piss them off by any other means as possible. And if you're a patient, I think the main thing is just try and be patient. I know it sounds a bit of a contradiction because patients normally aren't patient, and that's perfectly understandable, but try to be patient when you're in pain, which again is hard to do. But if you just take things calmly and steadily, one day at a time, expect the ups and the downs as well, you will get there. Progress will be made. So again, just those are my key points.
And so obviously people can go to your Instagram and your Twitter. I think you're documenting the process on both to kind of follow along. Where else can they learn more about you and from you, Adam?
So I'm across, all the social media platforms, but Twitter is where I tend to post most of my sort of research and sort of papers that I've read around certain things. Instagram just tends to be these videos that I'm doing when I document stuff. But I'm at Adam Meakins on both of those. You've got my website as well, which you can come and see what I've got to offer there with my blogs and other things on there. That's the sports.physio. And if you're a clinician and you're interested in learning an evidence-based approach and want a monthly or weekly educational platform that gives you top quality content in little bite-sized pieces, me and a colleague called Ben Cormack run the Better Clinician Project. And just for a low subscription fee, say each month, you'll get 3 pieces of top quality clinical content delivered, in an educational but entertaining manner as well, in very short bite-sized pieces, that looks at research, rehab, on various different topics and subjects in and around pain and pathology.
Awesome. Adam, thanks for being our first returning guest.
Thanks for having me back. I look forward to the third time.